afternoon and aloha. I want to thank all of you for coming down to the hale on a Sunday afternoon, and I want to particularly thank you for practicing social distancing, and that we continue to remind ourselves, all of us, to make sure that we do everything possible to prevent the spread of COVID-19 to each of us. I'm here this afternoon to announce a new emergency order that I just signed at 2:30 this afternoon for the City and County of Honolulu and for all the people of the island of Oahu, the purpose of which is to take strong and decisive action to stop the spread of COVID-19 on our island, the island of Oahu. It's kind of poignant that we have the bells tolling at Kawaihaau. The order is a stay-at-home, work-at-home order. All individuals living on the island of Oahu are ordered to stay at home and to work from home, except for essential activities. It takes effect 4:30 p.m. Monday, March 23rd, through Thursday, April 30th. It can be extended further depending on what we see in terms of the spread of COVID-19, and it could be reduced, although I believe that in all likelihood it'll probably be extended beyond April 30th. So I wanted to go through what essential activities are and what essential work is. So here are the activities that are essential that would allow you to leave your home and to do things around the City and County of Honolulu. Things that pertain to your safety, health and safety. Activities that pertain to necessary services or supplies. To engage in outdoor activity in locations as permitted by law. To perform work providing essential products and services. And to care for family member or pet in another household. These are broad definitions, but we want to make sure that the people of this island, almost 1 million strong, are able to take care of their loved ones and to do the things that keep us functioning as a people. So I wanted to go to the next slide that describes essential businesses, and we have 2 pages, and we'll provide this to you. But for example, healthcare operations and essential infrastructure are critical. Establish engagements in retail and sale of food and other household consumer products, food cultivation, services for our homeless or impoverished individuals. Of course, all of you out there, television, newspapers, radio, and other media services, gas stations and auto supply, auto repair, and related facilities, banks and related financial institutions, hardware stores, maintenance service providers, plumbers, electricians, exterminators, and others. Businesses providing mailing and shipping and delivery services. Educational institutions providing distance learning. Laundry service providers. Facilities that prepare and serve food, but only for delivery or carryout, because you have all restaurants, bars, and nightclubs are now closed. Next slide. Okay. Businesses supply products needed for people to work from home. Businesses supply other essential businesses with support or supplies necessary to operate. Airlines, taxis, and other private transportation providers. Home-based care for seniors, adults, or children, and or people with developmental disabilities. Residential facilities and shelters for seniors, adults, and children, and or people with developmental disabilities. Professional services as law or accounting services. Child care facilities providing services enable employees exempted in this order to work as permitted. And one thing I'm thinking for all of our first responders and our healthcare workers who are going to be working much harder in the days and weeks to come, knowing that they have their children being provided a place for them to go. Businesses that provide food, shelter, and other necessities for life for animals. Funeral, mortuary, cremation, burial, cemetery, and related services. Critical trades, critical labor union functions that are essential activities. Is that it? There are many. We may have left a few out. We may have had a few there we take away. It's not a perfect order, maybe. And if issues are raised that we think need to be adjusted, we'll amend the order. Just like we did the one for restaurants, bars, and nightclubs. When we were told by our major hospitals, does this apply to our hospital dining rooms and cafeterias? And we amended our order to allow them to continue to provide their essential services to healthcare workers in our hospitals and other health institutions. So why are we doing this? And I left my other paper upstairs in my office. Can you run up there and grab it, if you don't mind, very quickly? It's on the notepad. But while he's getting it, as you know, we see an increasing number of COVID-19 cases in the state of Hawaii. A week ago, this past weekend, I mean, not this past weekend, a week ago on the weekend, we had 3. We now have many, many more cases. And this spike, we believe, we're going to see continue. In the vast majority of the cases that we see today are in Oahu, which makes sense because we're a population of about 1 million people living very closely together, which provides that ability for this virus to be transmitted. And that's why we are taking this extraordinary action. Thanks. So you may know this already, but we have now 56 total cases for the state of Hawaii and 2 additional ones from the Department of Defense that we still need to confirm. That's 48 residents, 8 non-residents, and 2 pediatric cases. In the city and county of Honolulu, that's 41 individuals. On Maui, that's 9. On Kauai, that's 3. On Hawaii Island, 3. 5 individuals have been hospitalized out of that number. So I want to walk you through this slide. These are just projections, worst case scenario, perhaps, based on statistical analysis. The red line is based on international cases, excluding China, and the blue line is based on the United States cases. As you can see, we start very slow. The lines are aligned. And then in April, you start to see an increased spiking. We already see the number. And it goes up dramatically. So by the end of April, we are seeing 45,000 cases in the state of Hawaii, if this is correct. Worst case scenario, but it could be this. Next slide. This slide shows what countries around the world are experiencing, and some of them do different things. And as you can see, in places where stronger action is taken, the slope, the degree of the angle is much less. But as you see, the United States, which is not as high as other countries, but the slope is pretty darn steep. UK, United Kingdom, is another one whose slope is pretty steep. South Korea, which is a model for many, had an increased a number that went up pretty high quickly, and then they started instituting strong testing measures and stringent isolation, and you see it flattened out. Japan, Prime Minister Abe early on took strong action. Many people were upset initially, but Japan doing much better. Singapore, a unique island city-state, has strict quarantine rules and contact tracing, much lower than Hong Kong. So this slide shows and emphasizes that strong action can make a difference. Next slide. So this slide shows projected COVID-19 ICU patients in Hawaii. So ICU, intensive care units. We have a little under 300 intensive care units in the state of Hawaii. Just looking for the number here. So a little under 300. Oahu has the majority, 200 and something. But if you look at these different projections, so based on the US rate, which is blue, by around April 21st, 22nd, 23rd, we're going to exceed the capacity of our ICU units in the state of Hawaii. And after that, there's not sufficient ICU units for those who may be getting sick with COVID-19. Now, these units also have people who have heart attacks and other major health crises. And as this number climbs, we go into more of the Italy model, where our healthcare providers, the physicians and others, are making determinations about who lives and who dies, who gets a room with a ventilator in an intensive care unit, and who is put out in the hallway and may not survive. We don't want to face any of these different scenarios. These different lines show different countries. I'm looking at the United States. As you can see with Singapore, it never hits it because of their strong action. And again, these are projections based on statistical analysis. Next slide. So we're taking this action to buy time, to make sure that when you stay home and work at home and quarantine for 14 days, for those who travel here from somewhere else, whether you be visitors or residents, it'll make a tremendous difference. Governor Ige yesterday took the first hammer action by requiring the 14-day travel quarantine, the first of its kind in the United States of America, in any state. The second action, hammer action, is what we're taking today. So you can see, do nothing. You look at the curve, steep and continues to go up. Mitigation, which is what we've been doing until today. Actions about saying no gatherings of more than 10 people, which we took. Shutting down all public facilities, indoor and outdoor, including our parks. Requiring restaurants, bars, and nightclubs to close except for takeout and curbside pickup. That's all mitigation, and it can make a difference. But now with this new order of stay at home and work at home, which you call the hammer, along with what Governor Ige did, you see a decline in the growth rate and a coming down. 3 to 7 weeks, rough science, it may be less, it may be more. But during that time, it gives us all a chance to try to take mitigation measures and do hammer actions. Once the hammer kicks in, you get into a period which we call the dance. And by the way, this is not something we came up with. A person by the name of Tomas Puello came up with this diagram and how he sees it, and we agree. It's the dance. So it comes back down but doesn't go away. And this gives us time to take further action to catch up. And so the kind of things we're looking at in terms of catching up is to allow our healthcare community, our partners at the federal and state level, and of course also the county level, to do these kinds of things. Number one, make sure that we have a sufficient PPE supply network. Right now we're seeing we're going to be running out of PPE, and everyone is scrambling to find supplies from other places. Two, to have a more robust rapid testing capability than we have today. And yesterday, as you saw, down at Kaka'ako Waterfront Park, a little over 400 people were actually tested. Much more than 1,000 came in, and 400 or so were tested based on the criteria that were required. We need to do more of that with the right protocols. And we need rapid testing capabilities and results to come in. Number three, we need to increase the inventory of our medical supplies and equipment, such as ventilators. This dance provides that. And then make sure we have sufficient public health capabilities and sufficient staffing. And we're able to do systematic rapid contact testing, tracing, and other public health measures. Finding out where the infection is going, where it's spreading. And then more effective treatments are identified. That's hopefully a vaccine, but even as you read, there's other things being explored that may help mitigate. It buys time to do exactly that. So we've found that with those cities who only go the mitigation route, the epidemic gets worse, and it can overwhelm our health system. And those cities who fight through actions, such as what Governor Ige took with his 14-day travel quarantine, and now our action of stay at home and work at home, we help protect our residents and to make sure that we have the time and not overwhelm our healthcare system. This is very, very important. You know, at the end of the day, this is about protecting our ohana, all of our ohana, and saving lives. You know, we've all seen the pictures of teenagers, young adults at Sandy's, body surfing. They travel there together in a car, in close vicinity of each other, and travel home together. And they catch the virus or spread the virus, and they go back to their ohana. Their parents, their grandparents, their aunties, their uncles, their tutus. And maybe they're healthy enough to not suffer much, or maybe show no symptoms. But they're contagious and spread the virus, and one of their loved ones dies. We don't want this to happen. We want to save lives. So we expect all of you, all the people of the island of Oahu, in the city and county of Honolulu, to take this very, very seriously, to follow the order. Your cooperation will help us to be more effective, in stopping the spread of COVID-19. With that, I'd like Hiro Toya to come up and say a few words. Thank you very much.
Good afternoon, Hiro Toya, Director of Emergency Management for the City and County of Honolulu. As an island community, we have a unique opportunity here to put in very strong measures in order to protect our community. So, as Mayor stated, Governor Ige's 14-day travel quarantine, as well as the City and County stay-at-home, work-at-home order, are those strong measures that can really help our community right now. One thing we need right now is time. These measures are going to help us buy that time. You've heard that healthcare providers are having a critical shortage of personal protective equipment. Now, if we buy them some time, we can allow the manufacturing and the distribution of these supplies to ramp up so that we have sufficient supplies to be able to care for everybody. Again, there are other rapid testing capabilities that are being explored. So if we can buy some time, then we can put those into place and be able to quickly test everybody and isolate those individuals. That's the key thing, is to be able to test them quickly, get the results quickly, and isolate them immediately. We currently do not have that capability, and these measures will help us implement those. Now, in addition to these, the measures that the Mayor talked about, there's other things that the City and County is doing. This isn't the only thing that's part of our strategy. So we are going to continue to communicate with the public in as transparent of a manner as possible. We are going to continue to assist with the Department of Health with any resources and capabilities that they require to do their functions. And we are going to continue to ensure that the city's essential functions can continue. And now that means we're providing city departments with the most up-to-date guidance on how to protect their workforce and their customers. We're continuing to try to provide resources that the city departments need in order to implement hygiene and social mitigation measures, so things like getting hand sanitizer in place. In addition to that, we're going to put in a concerted effort to ensure the mental health well-being of all of our employees. Now, we are going to also identify gaps in social services. Times are tough, we understand, and we're going to do the best we can to provide social services and identify those gaps and coordinate the providing of resources for those social services. So we ask the public to continue with what we've been doing, all the measures that we've been talking about, social distancing, hand hygiene, not touching your face, staying at home when you're sick. These things still have to continue in parallel with the additional efforts that were announced today. And most importantly, please continue to look after one another. We all need to stay together and work as a whole community. Thank you.
We're going to open up for questions, and if you could raise your hand, and I will call on you and tell me who you would like to address your question to. We'll start with Ben. Mayor? And Ben, yeah, hold on just one second. We're going to try to get the mic over to you for the audience.
Thank you, Mayor. Wanted to know there are a lot of exemptions in this that are obviously necessary. How will this be enforced? Will it be similar to, will it be, I won't say the honor system, but how will you be able to tell the difference between people who have legitimate business out there from those who are just leaving the house for and hacking the shelves?
So in answering your question, I do want to point out the list that we have, in large part, we're following other cities. The city of San Francisco put in place the first stay-at-home, work-at-home order that I know of in any city in the country. And of course, we looked at the state of California, the state of New York, Illinois, and Ohio. And they're all kind of following each other in terms of the types of exceptions and exemptions in place. And we inquired with San Francisco, what has been the result so far. And for the most part, people are complying. For those cases where we see an egregious violation, the HPD following up and inquiring after first warning, there's going to be an education period. Today is a part education, so it doesn't take effect till tomorrow at 4:30, because all of you are going to report about it today, and people are going to educate themselves on it, and hopefully not violate this order. If they do go out and do not realize they're violating, they're going to be warned, and hopefully they'll correct their action. I don't think you're going to see a citation or anything worse than that. And should there be a flagrant violation and ignoring of the order, I could see a citation, and that will probably bring compliance with that person. But as I said yesterday, I think we really are a place of aloha and ohana. We don't want to get each other sick, and I believe people are going to comply. Just by issuing this order, I think we're going to see greater compliance. I have not yet heard of anyone violating the order on restaurants and bars and nightclubs. I drove around a little bit on the first day and saw people had shut down in the places where there was a lot of activity. We are a people who comply, and we're a people who care about each other and do not want to get them sick.
Okay,
Yes?
we'll go to, I think it's Christine.
Okay.
Yes, Mayor. The CDC issued guidance today, and I understand your administration got notice of it on Friday, saying that public restrooms should be open and stocked with hygiene products, and also that enforcement against homeless encampments should be stopped and they should be allowed to stay outside. Is your administration changing its stance on either of those two things?
So our administration is reviewing those recommendations by the CDC, and we'll be taking action based on those guidelines in the near future.
Okay, right here. And if, sorry, would you mind going to the...
Mayor, yesterday you said that when you met with the governor and the other mayors, you said there was agreement on what to do. Does the governor agree with you? What's the story?
So as I mentioned yesterday, we did meet with the governor, and after the press conference yesterday, we had a longer discussion about the stay home, work home order. Today we had a video teleconference with all the mayors and the governor and other. It was a very vigorous discussion led by the governor, and I think you're going to see other counties. The county of Maui says they're going forward today with their own order, and I think the other two counties are going to be working with the governor to issue a statewide order that should be coming in the next couple of days. We'll join in support of that order. I think the reason why Oahu went out first is because we have just so many people here and we're close together. And, as a mayor, we have 41 cases on Oahu, the most than any other island. So we didn't want to wait. We had a discussion about whether we should wait and go together. And we will join up with them when they go, but I think we need to go now. We don't want to see the 41 become 100 and 500 and thousands. And this is going to be starting to tamper it down through the hammer actions we've taken, and those are Governor Ige.
I think we have one from Ben, and then we'll go to Nick. Okay, and then Ed.
We have there the essential services. Will this include other city services such as licensing, registration, construction projects, those sorts of things, rail infrastructure project, and so forth during this time?
So many of those city services are going to remain in place. You know, we have a lot of really, truly essential functions like sewer and water and garbage pickup, but the others you described, like, you know, permitting, we don't want to see a shutdown of all construction. If we're going to crawl out of this, what's going to be a very steep recession in my mind, we need to continue to put work out in the street. And of course, the largest construction project in the history of this place ever is rail. Those will continue. We're not looking to shut down everything. We're just looking to have people stay at home if it's not necessary to travel about to protect themselves. Okay?
And I know visitor numbers are going down dramatically. Thursday is when the EGA's regulation goes into place, but are they being asked to stay in their hotel rooms under this as well, starting tomorrow?
So it applies to everybody, whether you're a visitor or whether you're a resident. And we'd expect between now and Thursday, visitors should not be out doing things that are not essential. And part of that is they should not be in Waikiki Beach. In our Kuhio Beach Park, for example, that is not an essential activity. Now, leisure, if it's walking down the sidewalk, you know, walking up to the Diamond Head Lookout, but sitting on the grass close to each other for a long period of time, more than 10 minutes, they're endangering themselves.
Mayor, if you see this continue where you see, you know, KP going to Sandy's Beach, gathering, have you talked to HPD about possible, you know, clearing these areas if you continue to see this a problem?
So what I would hope is that first our ocean safety folks, which are first responders, as you know, they're in trucks and they're roving, will drive along Sandy Beaches, you know, it's a long road along the coastline, and they have their megaphones telling people that the park is closed. Now, what makes it a little difficult is that below the wash of the waves, under Supreme Court decisions issued decades ago, the public has a right to access the beach below the high water mark. The city does not have control over that. The state does. We're trying to work with the state right now to see if the counties can get jurisdiction over that so that we can enforce for those who are on the beach below the high water mark. But I still think warning people as they walk through our park, we're going to ask our ocean safety people to tell folks they're not supposed to be in the park, that it's closed.
Mayor, have you estimated how many people on the island are considered non-essential to be affected by?
You know, that's a very good question that I'm not able to answer. You know, for example, for us, you know, we have 10,000 employees, and I'd say about 7,000 of the 10 have been deemed essential, which some people would think it's a lot. But just like you asked about driver's licensing and those kind of, we're not going to drive your test, but we are still issuing licenses and those kind of things. So unlike a hurricane, when the essential is a very limited number, clearing debris, staffing shelters, this is going to be a long and prolonged shutdown, or you know, a situation where you're going to need to work from home, and it means we ought to keep providing those services. So I think in the private sector, just like in the public sector, as they look at it, they're going to have to make some determinations about who's really essential in their businesses. Now, we've given the guidelines of what those are, but you know, I can't say if it's 100,000 or 300,000. It's going to be determined by the businesses under the guidelines that we provided.
Okay, question for Ben, and then we'll have one more, one final question from each party.
Okay. Transportation related here, and one, how will this affect city bus service? And two, you have a cruise ship that's going to be coming in this afternoon, and while they're not disembarking, maybe your thoughts on the cruise ships that come in very soon.
So on transportation, our bus and handy van, essential. People need it to get to their essential jobs, to their essential appointments, and handy van in particular. So we are continuing to provide that essential service. We are asking our customers to use social distancing. Our buses, we notice, are not as packed anymore. And that so they can sit in every other seat and maybe every other row. And of course, practicing good hygiene. If you're on the bus, you sneeze, you cough, please do it into your elbow, not on the back of someone else. And of course, the bus OTS is wiping down all high contact points, and they're going to continue to do that. We're even looking for more ways to disinfect our buses if possible. On the cruise ship, you know, I appreciate the fact that the state of Hawaii and the Department of Transportation has made strong stands in terms of who can come off the cruise ship. And as you say, they're not coming off. And as the mayor of the city and county of Honolulu, where the ship is docked, that's refreshing to me. The decisions they did make on the others regarding residents, as long as the protocols were there, I'd leave that up to the Department of Health, the Coast Guard, and our medical community.
Okay, and then we'll start with Christina.
Yeah.
Go over here, and then Nikki, and then finally Eddie.
Mayor, does the city have any plan to house all the unsheltered homeless people that you say are public safety hazard right now, either in hotels or residential properties or the Ka'ahi facility, to isolate them? Because in shelters, there's still interaction person to person.
So on that question, as you know, I think the city leads in the state of Hawaii in terms of finding a facility for those homeless who are diagnosed with COVID-19, and that is at Ka'ahi Street. And so, but to answer that, so we are providing a place that can probably house up to maybe 50 or 60 homeless individuals who are diagnosed with COVID-19, a maximum around that amount. We are looking for other places should that amount exceed that level. And we've talked to hotels. We have not talked to residents, but if you're interested in housing one, let us know. You know, we could maybe work with you. But we've talked to hotels, and we're also looking at other potential sites, vacant buildings in Honolulu that maybe were going to be sold but never were sold, and perhaps those could be used too. But we'd be working closely with our state partners because, as I said many times, the City and County of Honolulu does not have a Department of Health. We do not have any of the wraparound health services that are extremely important if we're going to be successful. And so whatever other places we locate, we need to have 100% agreement from the State of Hawaii Department of Health that they're going to provide all those wraparound services. An example of a health component was the testing we did in Kaka'ako yesterday. We provided the site, we provided the police, we provided our transportation service folks to make sure everything went smoothly, but we worked with a private health outfit that did the actual testing. We're looking for those type of partnerships going forward.
Okay, and we'll go to Nikki, Eddie.
Yes.
Does that mean until April 30th? And are all churches now considered closed?
No, I think one of the exceptions, Ernest, is places of worship. Yeah, Ernest, are you here? I thought I saw him here. Oh, yeah. Place of worship, so they need to shut down? No, they're exempted, right? They're not? So what is the answer? Are they, do you want to answer that?
They're not exempt, so they got to comply.
So places of worship need to comply. And my understanding is, you know, just anecdotally watching your in the news, is that many of them are complying. Starting from, you know, the heads of many of these major religions around the world are no longer having services in these facilities, whether they be Christian or otherwise.
Okay, we'll go to Eddie.
Eddie?
You have a follow-up?
Oh, yeah. Do you want?
Yeah, the schools. Are schools out till the 30th?
So as you notice, we wrote it the way we did. Should the schools come back into session, that would be allowed. That would be a determination by the Department of Education. I don't think they made that decision yet, but with what we're seeing, I wouldn't be surprised if you saw them continue their not coming back to school.
Okay, well, Eddie, and then
Just two questions. So someone on Facebook asked about hotel workers, because they looked through the list and just wanted clarification on if they're a hotel worker, does this apply to them as essential? And the second question is, you know, if you're practicing social distancing and want to go for that morning run along Ala Moana Beach Park, I mean, would you condemn that, or?
So on the hotel workers, they are deemed essential. People who work in the hotel itself, and if they're in a restaurant that's providing take out orders. They're essential, so it does not impact them. And for running, I would suggest to not run into Ala Moana Beach Park, but to do what I'm going to be doing, running along the sidewalk, along the park, in other places, practicing very good social distancing. For me, I'm going to run by myself.
Okay, one final question.
Do you have any idea of what it's going to take to end this war?
I think it's going to take all of us working together. When I say all of us, the members of this planet, we're all learning from each other. I think we are copying each other's best practices. Part of this order today is following best practices in countries and in cities and in states where we've seen it's making a difference. But I think we're just at the beginning of this pandemic for us, the United States, and for Hawaii. I do think that our community, the medical community, is working hard to find a way to find a vaccination and coming up with other treatments. So I'm hopeful. I just can't answer your question as how long it's going to be. And I don't think we should build up expectations that it's going to be quick. It's going to be a long time. Huh? For criteria? I don't know. Hiro, come on up and can answer that. Thanks.
So, really the heart of this is ramping up our healthcare system and public health system so that we can deal with an influx of new cases, right? So we can't keep our island closed off forever. We can't people shut in their homes forever. But by taking drastic measures now, we can buy time to ramp up those capabilities. So we're going to be in close coordination with the healthcare providers to assess their readiness to treat new patients. And we're going to work in close coordination with public health to ensure that testing capabilities are in place and that epidemiological investigation capabilities are in place so that when we do get cases, we can address them more effectively. So really, we will eventually get an influx of cases, but we need time now to be able to prepare ourselves and all of our systems to be able to address those new cases when they do happen.
Okay, and we have just some short final comments from Mayor Baldwin.
So in conclusion, I just want to emphasize again, I believe those cities that fight and do the hammer, like we're doing today, and also what Governor Ige did yesterday, and then to dance, have a more dramatic impact on the health and safety of our community than cities who just mitigate. And we moved beyond the mitigation level today to the fighting level. I want to thank all of you. I want to ask everyone in the city and county of Honolulu, almost 1 million strong, to follow this order, to work together, to care for each other, and appeal to the very best angels we have in our heart as we go forward in the coming weeks and months. Thank you.
Thank you, everyone.